As a family daycare educator, you probably talk to your families constantly. You talk to them about what their child is learning, what they ate, their health, their friends, and their fees. You probably have to have hard conversations with them sometimes too. You now have to display your services rating poster that looks something like this. Are you confident in explaining to parents about the 7 quality areas and what they mean? The more you know, the easier it will be.
The quality rating poster might spark more conversations between you and families. It's more visible, it's out there, it's on your front door.
When I displayed the poster, I actually had a new parent ask questions about the poster, wanting to know what it was all about.
We are very confident that our educators would be able to explain the new ratings poster. There are conversations constantly about quality, but it may not necessarily link to the quality standards. It's more around what their expectations are for education and care for their child.
So how do you talk to parents about quality if your service is rated as working towards the NQS? How do you talk to prospective parents? How do you talk to existing parents?
The introduction of the quality rating poster is a great opportunity for you to talk to families about quality in your family daycare home. Whilst we understand that the poster captures your assessment and rating, what it also does, it gives you an opportunity to share with families some of your ambitious goals, your dreams, and the strategies you have in mind to improve quality. Use that poster to your advantage. Use it to start a conversation, to map the way forward, and to see parents as partners in the quality journey.
New South Wales Family Daycare Association has created a video to help explain quality ratings and the NQS to parents. This is a great starting point for families who have general questions about the rating system and what your rating means. They may have seen an ad on social media or heard a friend talking about it. They may have seen the poster displayed in your home. As you know, your service is currently rated as working towards the national quality standard. It is possible that some families might be concerned that you are not rated more highly. Of course, it's also possible that some families are not concerned, that they are more than happy with the quality of care you provide. But what can you say if parents are concerned?
Some tips for how to engage families in conversations about quality. I think the first thing is be yourself. You don't have to put on a performance. Just be yourself and do it in the context of a trusting relationship that you have with families. That's the most important thing.
While jargon is really important, kind of those big words that we use to define our work, it's really important that we avoid much of that when we talk about quality to families. It's actually making our language accessible to families.
You need to ensure that parents understand that the children in your care are safe and well looked after. You can tell them that all FDC services have to follow the Education Services Law and regulations at all times, and that these ensure that your child is always safe. You can tell them that quality is rated along a scale, starting with a very high benchmark, that you were rated as working towards this time, but your service is doing a lot of work to improve that rating. You can also tell them that the entire service is rated, not you individually, that the rating doesn't necessarily reflect the care that the child is provided in your home. You can break down your rating beyond the working towards label. Point out the quality areas that you did well in and communicate how you're working to improve in the ones you didn't. Also remember, you, as an educator, don't have to have all the answers. If a family or parent seems very concerned, refer them to the coordinator or manager of your service.
What our research showed was that even when parents are aware of a service's quality rating, it doesn't necessarily inform their decision making. The biggest influence was gut feeling, the sense of, when you walk into a service, you sort of have that feel that your child is going to be safe and happy.
I think a lot of it can feel quite intangible, and I think for a parent arriving in a service and feeling like there's an atmosphere that feels right for your child is a good indicator of quality.
Talking about quality is important because all of us want to provide the best education and care we can. And being able to have those difficult conversations about quality is actually part of being a quality service.